Hi, good evening everybody, and welcome to our NHS Smoking Cessation Service webinar for Greater Manchester. I'm Louise Gackley. I'm the Chief of Bolton LPC. I'm also the Vice Chair of the Community Pharmacy Provider Board. I'm joined tonight by my colleague Alison from the Midlands and Lancs CSU, who've been commissioned to support the rollout of this service nationally. We're also joined by Lauren from Fairfield Hospital and Rochdale Infirmary, Northern Care Alliance, and by Emily and Alicia from Wythenshawe Hospital from the MFT. Next slide, please, Alison. Thank you. So a little bit about GM Healthcare Academy before we get started. So here we are. We're a partnership between the NHS and community pharmacy, and we're supported by some key education providers. Our focus is engaging and supporting you out there in community pharmacy and your teams to achieve your full potential in service delivery. And to do that, we run a range of training events throughout the year, most of which are free to attend, and we support the whole pharmacy team with the training. Next slide. Thank you. So there we are on the slide of who we are. Our founding members were the GM Health and Social Care Partnership, now GMIC, the Pharmacy LPN, both LPCs, Greater Manchester and Bolton, and our provider company CHL, also with some support there from CPPA. So a little bit of Zoom webinar housekeeping. Please keep yourselves on mute if you're not presenting or talking, just to avoid any interference during the presentation. You can use the chat box to add any questions for the presenters tonight. And at the end of the webinar, there'll be plenty of time for the Q&A. At that point as well, you can unmute yourself if you'd like to talk with us. A couple of requests before we really get started. The first is that if you are from Oldham or from Bolton, can you please identify yourselves in the chat? Just put Oldham or Bolton in there, just so that you know if we've got any Oldham or Bolton contractors with us tonight. The second thing is, and it's a question not related to the smoking cessation service, it's about the GM minor ailment service. So for those of you here that are working in any area that is not Salford, Stockport, Bolton or Oldham, and you provide the minor ailment service, would you please answer yes or no in the chat with your ODS code to the following question? And the question is, do you think that changing the eligibility criteria for the service to the same as the back of a prescription would increase the number of patients accessing the minor ailment service in your pharmacy? And that'll just help us a little piece of work that we're doing at the moment around service delivery and the minor ailment service. So if pop that into chat, we'd be really grateful of your help with that. Next slide, please, Alison. So on to tonight, following the introduction, we're going to have a service overview from Alison, and then both the cure teams from Northern Care Alliance and MFT are going to give a presentation about how the service is running at the Trust, and I will finish off with just a few slides around service delivery and pharma outcomes. Next slide. And now I'll hand over to Alison. Thank you.
Thanks, Lou. So I'm just going to give you a little bit of an overview, some background to the NHS smoking cessation, talk to you a little bit about the pilot that we had here in Greater Manchester in Oldham, and an update on the national implementation. So in terms of the background, I'm sure everybody's heard of the NHS long-term plan, and prevention is a core component of that long-term plan. And that sets out the NHS's contribution to tackling tobacco dependence. And by the financial year 23-24, all people who are admitted to hospital who smoke will be offered free NHS-funded tobacco treatment services. So these commitments in the long-term plan are designed to be the NHS's contribution to helping to deliver a smoke-free generation, and they build on the good work that's already been delivered and complement those current stop smoking services. And it's intended to introduce a level of national direction, but with local development and delivery. So we know that smoking cessation programmes already exist in community settings, but they do vary in their involvement of community pharmacy. So the hospital inpatient service will be adopting the Ottawa model of smoking cessation, which will be adopted throughout England. It's a 12-week programme, and it requires a follow-up of smoking cessation treatment after discharge from hospital. It shows that increased 1-year quit rates by 11%, and it is expected to save the NHS £85 million within a year. So the aim of the NHS smoking cessation is to support the delivery of the prevention ambitions in the NHS long-term plan, and for community pharmacy to become a nationally available choice for patients to access smoking cessation support post-discharge. As I mentioned, there were a couple of pilots for the NHS smoking cessation service. The first pilot started back in October 2020, with referrals from the Royal Oldham Hospital being sent to community pharmacies in the Oldham area. We selected the pharmacies following an expression of interest process to give good geographical coverage and extended opening hours. A second pilot area then went live the following year in the Lambeth and Southwark boroughs of London, working with Guy's and St Thomas Hospital and King's College Hospital. Those pilots have now transitioned into the nationally commissioned smoking cessation service. In terms of some data, here's some numbers from the Oldham pilot that we had here in Greater Manchester. So in just over a year, we had 200 patients referred, and of those, the engagement rate to enrol patients into the service in community pharmacy was 40%. Those patients then went on to have a 4-week quit rate of 57% and a 12-week quit rate of 23%, which is along the lines of the locally commissioned stop smoking services. So the pilot results were really positive in terms of the role that community pharmacy can play with patients discharged from hospital. So once the pilot's activity was finished, there was some negotiations and discussions between NHS England and the PSNC. A standard treatment programme was developed with the NCSCT. The service funding was agreed, with the consultation fees being paid as part of the community pharmacy contractual framework, and the NRT costs being recharged back to the ICB. The service specification was agreed, and there was a soft launch of the service back in March 2022. And it was an intentional soft launch because the status of different trusts around the country in terms of implementing their tobacco dependence teams is very different. So the Midlands and Lancashire CSU, as Louise said, has been commissioned by NHS England to support the national implementation of the smoking cessation service. So there's a number of different pharmacists like myself who are covering regions across the country, and I look after the North West region, so Greater Manchester along with Cheshire and Mersey and Lancs and South Cumbria. The role of the CSUs initially is around scoping and mapping, so understanding the position of each acute trust in terms of their delivery of the relevant parts of the long-term plan, and then identifying key stakeholders to support the setup of working groups. We then facilitate implementation at a local level, ensuring that those pilot sites have transitioned successfully, and then engaging with the trusts who are looking to start delivery of the service imminently. We have a 3-stage process to go live, so that initial scoping and mapping stage, setting up the working groups, identifying the key stakeholders. Then we work with the trust to agree the pathway that's going to be used to send referrals to community pharmacy from the trust, and in Greater Manchester that will be farm outcomes across the board. Then we move into stage 3, which is community pharmacy engagement, working very closely with the LPCs in the area, and hence the reason why we're here this evening to do some engagement with community pharmacies around what's happening in Greater Manchester with the SCS service. So the pathway is very simple. The patient is undertaking a supported quit attempt by Emily and Alicia and Lauren and their teams in the hospitals. And at the point of discharge, then there's some options for that patient, whether they get referred to a locally commissioned service or through the SCS referral pathway to a community pharmacy, or the patient may decide to opt for self-care and there's no transfer of care on discharge. The model of care that you see on the screen here is in the service specification, so hopefully everybody should be familiar with this. So the red boxes at the top are the cure teams within the hospital, the tobacco dependence teams, where they're identifying a patient who's been admitted to hospital as a smoker and initiating some support whilst that patient has been admitted with NRT and behavioural support. The blue boxes in the middle represent the transfer of care, so the patient agrees to be referred to a community pharmacy and picks which pharmacy they want to be referred to. That electronic referral is then sent upon discharge, and contact is made between the patient and the pharmacy within that 5-day period. And then the green boxes at the bottom represent that patient fully transitioning into the SCS service in the community pharmacy. So the patient registers, has their initial appointment with the pharmacy, and then is supported up to 12 weeks with post-event messaging being sent back to the trust and also to the patient's GP practice. Just to pull a few points out from the service spec for pharmacies, just to make sure that everybody understands the scope of the service that needs to be delivered. So the SCS is intended to complement existing locally commissioned stop smoking services. So if you do already offer a service that's commissioned by your local authority, then you will deliver these two services alongside each other. You can only see patients in the SCS who have been referred from the NHS Acute Trust and who wish to continue their quit attempt post-discharge. It's really important that you contact the patient within 5 days of that referral being sent, and you must make at least 3 attempts to contact that patient. If you can't get in touch with the patient, then you do need to inform the trust by rejecting the referral in Farm Outcomes and putting some notes in to explain the reason why. You can provide support for patients up to 12 weeks with consultations, either weekly or fortnightly, which you can deliver face-to-face or remotely as appropriate. And that NRT supply must be maximum of 2 weeks at a time. And there is an agreed list of GSL products that you can supply under the service in the drug tariff. You need to make a clinical record of all service activity. So in GM, you're probably going to use Farm Outcomes because that's the system that's going to be sending the referrals to you. If you do face-to-face consultations with your patients, then you should use carbon monoxide monitoring to support that quit attempt with the patient. There's no charges to patients at all, even if they pay for their prescriptions. And there is some patient level outcome data which is required to be returned to the referring trust and the patient's GP. The details for that are in the service specification in the appendices at the back. In terms of fees, if you've registered with the BSA, then you should have received your setup fee. You then get £30 for that initial consultation, £10 for your interim consultations, and £40 for the last consultation with the patient, which can be any time from week 4. You need to submit those claims manually on the NHS BSA Manage Your Service portal. In terms of training, if you have registered on the BSA website, then hopefully you've done all this already. So you need to complete the NCSCT Stop Smoking Practitioner Certification. If you've already done that as part of a locally commissioned service, that's fine. You don't need to repeat it for the purposes of the SCS. There are some additional specialist NCSCT e-learning modules that you also need to complete around treatment for people with a mental health condition and pregnant women, as well as the module on using e-cigarettes. And you must read the NCSCT standard treatment programme, really familiarise yourself with that document because that's what you're going to use to support the consultations that you deliver with the patient. So really recommend that you familiarise yourself with that document. You're also going to need a carbon monoxide monitor and a standard operating procedure in place. And if you don't have your carbon monoxide monitor yet, please check the PSNC website because that does have a list of devices which are approved for the service. In terms of an update in Greater Manchester, it's all looking quite nice and green on this slide, which is fantastic. So we've had really good engagement with the different trusts around Greater Manchester. We've got Oldham and Bolton hospitals both currently live. Oldham continued from the pilot, so they officially went live with the Nationally Commissioned Service back in March, and Bolton going live at the end of October. And we've got some anticipated dates on there for some of the trusts, but I think Louise has got a bit more of an up-to-date slide in terms of go live dates in her section. And this is just a little bit of a map that shows you where all the pharmacies are that are signed up. We've got 300 pharmacies across Greater Manchester signed up to deliver this service, which is fantastic. The ones in green are the ones that are actively receiving referrals, and you can see they're in Bolton and Oldham, so that matches up with the trusts that are currently live with the service at the moment. So as I mentioned, we've got Royal Oldham and Royal Bolton Hospital both live. They are using Farm Outcomes to send referrals, but they're using a slightly different version, a local version that we put together for them in Greater Manchester. I mentioned that we've got the hospital cure teams attending today. So we've got Emily and Alicia from MFT, and we've got Lauren from Fairfield General and Rochdale. So one of the outcomes of today is that we'd like to make sure that we've got lots of sign-ups in the right places in Greater Manchester, and make sure we've got enough pharmacies for those trusts to be able to confidently refer patients to. Last slide from me is just a couple of resources, where you will get a copy of the slides after the session today. So do have a look at that PSNC page. It's got lots of information about the service. Service spec is linked there, as well as the dashboard, which was the map that I showed you with the pharmacy sign-ups, and also a link to the standard treatment programme. So I'm going to hand over now to Lauren.
Thank you very much for that. I don't know if I need to take control or not, just because I have put animations on the slides. I don't know if you've taken them off when I handed the presentation over. I
haven't taken the animations off now. I'll try and read it, Lauren, if that's okay.
Yeah, that's fine. So my name's Lauren. I'm one of the tobacco specialist nurses working at Fairfield and Rochdale hospitals. So next slide. So the role of the cure team. So smoking cessation has always been very negative with patients. The message that people tend to sort of take is always very negative, and it's always, you must stop, you cannot do this, you must put the cigarettes down, you walk away from them, never touch them again. And the cure team is trying to change the way that people think about smoking. It is an addiction, it is a problem, it is something that people need help with. They cannot always put those cigarettes down and walk away. And there's a lot of misinformation out there that we are there to help with these patients and help them understand that it's something that needs, something that they need help with, and it's not always something that can be done on their own. Next slide. So whilst the patient is in the hospital, we receive an online referral from the ward when the patient's admitted. It's a single question: does the patient smoke or chew tobacco products? And there are times where we will get patients that smoke or use e-cigarettes as well. It's not the best system at the moment. It is being improved, but every patient that does smoke will have a referral sent to us. It's an opt-out system as well. So those patients will always be seen by us, even if they say to the nurse on the ward, they don't want to see, I don't want to quit, I don't want to do this. We'll still go and see them to make sure they have all the information available to make that decision. We see them within the first 48 hours of them being admitted to the hospital. And then we sit down and talk to them for about 40 to 60 minutes about their smoking habits and about what they want from our service and whether they do want anything from our service. So we complete the Fagerstrom score of nicotine addiction, making sure that we're offering the right level of nicotine product for them. Discuss whether they want to quit, whether they just want abstinence whilst they're in hospital, or even just giving them advice and just sitting there and having a chat with that patient about their smoking habits. Some patients are discharged before we see them in the hospital, but we do ring them after they have left the hospital to make sure that they are, at least contacted. And if they did want something whilst they're in hospital, they've always got that option when we ring them to be referred to the community services or through farm outcomes to the local pharmacies. So we do offer behavioural support for the patients. We'll see them every week whilst they're in hospital. And some are in for a few days, some can be in hospital for more than a month. And we do keep track of those patients and we do see them throughout their stays in hospital. We talk about their habits, their triggers, their addiction, and teaching them ways to change how they think about smoking. And it's sort of counselling in a way, but it's counselling regarding their smoking habits and changing the way that, say, they have a cigarette after lunch and that's their trigger, that's what they want. They want a cigarette after lunch. We'll sit down and talk to them about different ways of avoiding those triggers and doing something else instead of smoking in those situations. So we do offer them the nicotine products. We explain the product, we give them a leaflet with the same information that we have explained to them as well, so they do know about the product before we give it to them. And then we ask the doctors to prescribe the medications for them. So our team, my team at the moment, currently sees Rochdale and Fairfield. There is another cure team at Salford. There's one over at Oldham for the north side of Manchester. And then you've got MFT, you've got Tameside, you've got all the other cure teams, which will all be referring as well. So nicotine replacement therapy, we can offer NRT to any patient who uses tobacco. And in some cases, we do offer it to patients that want to come off e-cigarettes as well, but that is very rare. We do have a look at the holistic side of the patient. We look at everything about that patient, whether they can use the medication, whether they can open the medication, things like that as well. So we wouldn't offer oral products to a nil by mouth patient due to risk of aspiration, things like that. We differ what we offer patients. The majority are on combination therapy. Some patients just want a patch. Some patients just want something that's short acting. And that's entirely up to them whether they choose to take our advice on what they want. It's up to them at the end of the day. And sometimes at the moment, they're not receiving NRT. We are working on changing that. I think it is just our hospitals at the moment. We're having trouble with inhalators across the whole of GM at the moment. But we are trying to work through that from the hospital side of things as well. And we also try to make sure that the patient is discharged with 2 weeks worth of medication. Again, our hospital currently having a slight issue with that, but we are working on it with training, and we do check up on the patient afterwards to make sure that they have gone home with 2 weeks supply. So what can we offer? It's the different nicotine patches, nicotine inhalators, nicotine chewing gum. I should have thought about this before sending you the presentation and actually taken off the the animations. I do apologise. So these are all the different things that we can offer for the patients in the hospitals. And then referrals. If the patient agrees to a crit attempt, we will refer them to the community teams on discharge if they agree to it. The smoking cessation services for each area differs in what they can offer. So the Bury Lifestyle Service will only offer behavioural support and not nicotine products, whereas Rochdale can offer prescription price nicotine and behavioural support. So the patients in Bury will go home with those 2 weeks worth of medication, and then they won't receive anything more after that. They will have to buy it for themselves. And at the moment, with the cost of living crisis and trying to go to Boots and buy in your nicotine replacement, it can be quite expensive. But with the addition of farm outcomes, we can offer the patients to quit using the pharmacy services instead. So they will have access to that NRT through yourselves instead. Thank you.
Thanks very much, Lauren. That was really helpful. Thank you. So hand over now to Emily and Alicia for their MFT view of the world.
Good evening, everyone. Just to introduce myself and my colleague. So my name is Alicia and I'm presenting alongside Emily. And we are both cure nurse leads for North Manchester and for Oxford Road. But myself and Emily both have come from within Shaw Hospital, in which the Cure project was established in 2018 after the pilot. We were fortunate to be a part of the ever-expanding Cure process. So myself and Emily have recently just launched the Cure project at North Manchester General and Oxford Road within the last couple of months. Okay, next slide, please. So this is just a brief slide on some facts and figures, and we feel that this slide around the facts and figures highlights the importance of having an inpatient tobacco dependent service. So we know that 1 in 2 people will die from illnesses caused by smoking. For every 1 person that dies from smoking, 30 more will live with a serious illness caused by smoking. 4 in 10 ex-smokers mistakenly believe that nicotine in cigarettes is the cause of most of the cancer-related illnesses. 2/3 of people who smoke say they would like to quit, which is fantastic. And just some of the key points is that a person that smokes is 3 times more likely to stop with treatment and the support of a specialist. Therefore, being admitted into hospital is a massive opportunity for patients that smoke to commence on some sort of intervention with specialist support. And we class this as a teachable moment, because actually it's, as I say, it's a really important opportunity for us to be able to give the patient exactly the right advice, and let them know exactly what's out there and available to them, and whether they sort of want to commence on treatment straight away, even if it's not sort of stopping smoking at that point, we look at reduce to quit methods, and also if it's just a case of planting the seed and building a rapport with the patient, and if they again are readmitted, or sort of want to go down the route of smoking specialist support further down the line, we've planted that seed when they were an inpatient. And it is also every healthcare professional's responsibility to identify patients that smoke and ensure the appropriate treatment and support is provided. So what is the Cure project? So we are a comprehensive tobacco dependency treatment programme for all the patients that smoke and are admitted to hospital across GM. So how the Cure service works across MFT, so it systematically identifies all smokers that are admitted to hospital, and it creates an automatic opt-out referral to the tobacco dependent specialist nurses, and this electronic referral is done via Hive. So I know everybody isn't working off the same sort of patient record system, and this is a new system that we've just had implemented from September. So we're still sort of getting used to that and actually going around to the wards ourselves and making sure that staff and the medical team are aware of how to refer. So the admitting teams, be that the medics, to provide very brief advice, which our clinical lead up with Ensure, Matt Everson, has put together a fantastic BPA, which prompts the medical team to offer very brief advice on that initial admission and prescribe nicotine replacement therapy using the prescribing protocol. And that just sort of gives us a bit of a head start. So actually we know that the patient has something there if they wish to use it. And then once the referral is received by the team, we go and review it. The specialist nurses go and review, the patient. And again, just as Lauren's mentioned, we discuss behavioural changes, NRT interventions, and we also have the vaping kits available at Withenshaw Hospital. So follow-up and ongoing care plans after the patient is discharged is currently we refer out to community stop smoking services. We have an established follow-up service at Withenshaw at the moment. We are just sort of in the near future awaiting for the smoke-free app to become available to patients, which they will be able to get support and treatment from the app, and it gets posted out to them. And obviously plans to refer to the pharmacy service. And sort of the educational side of the programme is for us as the Cure specialists to upskill the rest of the workforce. And we just start by encouraging the hospital staff to engage in the Cure e-learning modules 1 and 2.
So as Alison was mentioning before, Cure's based on the Ottawa model from Canada, which is a proven service over there. And it was implemented and established first at Withenshaw. It's been recognised nationally as best practice, and it's referenced in, as we were saying before, in the NHS long-term plan and other respiratory and lung cancer reports. Next slide. Secure itself stands for conversation, so it's about having that right conversation with every patient every time, asking the right questions to establish whether they smoke, and then it's about understanding the nicotine myth. So a lot of people still sort of believe that the nicotine is the harmful aspect of smoking, and it's uniquely addictive, but it's relatively harmless. So it's about sort of explaining that to patients, and also educating staff about how we start patients on the nicotine replacement to help with that withdrawal, and to help support their quit attempt. So replace, we look at starting the nicotine replacement as soon as that patient's admitted to hospital, and in line with the cure prescribing protocol. And then E is for the evidence-based treatments. So that's when the cure practitioners come along and have that more specialist discussion and support, and then look at offering that discharge pathway. Next slide. So currently at MFT, we've just implemented the cure prescribing protocol. So this is based on the current evidence from the GMMG. So that suggests that we start all patients on high strength combination NRT, as there's a lot of evidence to support that it's more effective than the lower strengths and the monotherapy, obviously in line with patient choice. So the medical team and the prescribers will use the step 1 and step 2 to start that off on admission, and then we'll come along and do the cure assessment. And currently at MFT, we use a protocol for supply. So our protocol allows us to supply up to 4 weeks. And as Alicia was saying before, vaping kits is part of that treatment pathway. Next slide. So just a bit on vaping and e-cigarettes. So the vaping offer is currently established with Ensure. Myself and Alicia are newly launching at North and MRI, but there are plans to offer the vaping kits there as well. So we know that vaping is an evidence-based stop smoking intervention and has been found twice as effective as NRT, and has been found substantially less harmful than smoking. MFT is looking to become the first trust to become vape friendly, and it will provide quit zones for use on the external hospital grounds, to support everyone that sort of comes onto the site to be tobacco free. Patients, when if we do supply vapes as part of our treatment pathway, at the moment, some of the services that we discharge them to will look at continuing their vapes, but otherwise we talk to the patient about how they can purchase more liquids after discharge. We give them a 4-week supply. Next slide. And then just coming on to the discharge pathway, so all inpatients will be offered a choice of that ongoing follow-up support as part of their cure assessment. The cure team refer the patient onto their chosen service following the assessment, and the contact details are given to the patient. So currently we've got the cure teams that will follow up the patient, and as Alicia said before, the local community teams and the Smoke Free app, and we're looking forward to referring into the pharmacy services. And then we just communicate to the GP what treatment's been commenced, and the details of that follow-up referral. Next slide. Thank you.
Thank you.
Thanks.
Thank you, Lauren, Emily and Alicia. That was a really good overview of everything that's happening in the hospitals, and so hopefully our teams now will have a good understanding of what happens for a patient before they end up in the pharmacy service. So moving on now, I'm just going to do a few slides on deployment and pharm outcomes. So first slide here, the GM deployment. So as we've already mentioned, pharm outcomes has been procured by GMIC on behalf of the NHS Trust in Greater Manchester. So all trusts will be able to use pharm outcomes and make referrals that way. Trusts have all been engaged with. They've all had discussions around the pharmacy service, and all trusts with active cure teams in place are keen to go ahead, some very early in the new year. And like we said before, we do have 2 hospitals live, Royal Bolton and Royal Oldham, and I'll quickly go through the full deployment list for you on the next slide. So here we are. So as you can see, we've got Oldham and Bolton live. Oldham have been for quite a while now as part of the pilot, and Bolton a little bit more recently. Straight into the new year, we've got Fairfield and Rochdale with go live dates of the 4th of January, quickly followed by Manchester Royal, North Manchester General with Ensure, and Royal Albert Edward on the 9th. We've got Tameside there in the Christie looking at mid-January, but to be confirmed, and a to be confirmed date for Stepping Hill in January as well. And finally on that list, we've got Salford Royal looking at February. So as you can see, we've got quite a lot of trusts there that are keen to get started with the service early in the new year, and start making referrals across to pharmacy. Next slide, thanks. Right, okay. So this slide is quite detailed, and we will make it available to you after the webinar tonight. It's showing the data flow and the patient flow through the service, and I'm not going to go through each box in detail because it'll probably confuse you, as it will me, without looking at it in detail. But it does show a really clear overview of the patient pathway. So the top bit there in blue is what happens to a patient in the hospital, starting with when they're identified as a smoker, right through to the point that they leave the hospital and enter the pharmacy service. The pharmacy service pathway there, it shows you how it lands in Farm Outcomes, your referral, your contact with the patient within the 5 working days. That's the really important bit. You must contact the patients within 5 working days. Through then to the support that you can offer to those patients through the different stages, 4 and 12-week quits, the interim appointments, the supply of the NRT if appropriate, to the point where hopefully we discharge patients following their quit attempt at 12 weeks. At the end there, it shows a little bit of data back into the trust that we need to ensure goes, and also data back into the GP practice as well at the bottom. Thanks, Alison. If you can, next slide. There we go. So, like we've said, Farm Outcomes, it will always start with an electronic referral from the hospital to you, and that will appear in your services tab on Farm Outcomes in the same way that you would see a referral for DMS or GPC PCS now. The Farm Outcomes solution does support the hospital team, so they can record the demographics, quit date, and the NRT that's already been supplied at their end, so you've got a full understanding of what's happened to that patient before they are discharged from hospital, as part of that referral into the pharmacy. You've then got a series of modules that I'll go through in a little bit more detail shortly, to complete at various points during that patient's quit attempt. I'll cover NYS shortly in another slide. So the IT pathway here, this is just a really quick summary of it. We will be working down the left-hand side mainly. So hospital sends referrals via Farm Outcomes. That's the usual method, and the method that all trusts in GM are planning to use. You'll be able to then populate the Farm Outcomes modules, and you'll submit your claim manually via NYS. That's the important bit that we'll give a bit more detail on later. There is a chance you may receive some referrals via NHS mail. Those will likely be referrals that will come to you from outside of Greater Manchester. So do look out for those as well when you're doing your checks of your shared mailboxes. And there are some manual entry modules there as well that you can use if need be. Next slide, please. There we go. So this is a bit more detail here about the data recording in Farm Outcomes, and it's set up as a linked template, and you can record the patient's progress throughout their behavioural change support. And there's 5 different modules for you to use. So your initial referral will come, like I said, in the services tab. It'll be linked to the referral, so you'll complete it on that referral that comes from the hospital. You've then got your interim appointment template that you can fill in, your 4 and 12-week quit appointments. You've got a method there to onwardly refer a patient to another pharmacy, for example, if they've moved or they no longer want to use your pharmacy, or you're unable to provide the service for some reason. And finally there, you've got the method to record any referrals that are received by your pharmacy via email, so the manual entry method. And next slide. Thank you. So Farm Outcomes, what's it going to cost? At the moment, it's free. We do know that at some point, hopefully early in the new year, there will be an integrated module available where the data will transfer automatically for you into NYS, and that will come at a cost under the provider pays model. So you'll have 2 choices at that point. Your first choice will be to carry on at transferring data manually onto NYS, or you can at that point decide that you'll pay that small fee to Farm Outcomes, and they will do that data transfer to NYS for you. But you will have a choice, and you'll be given notice before that happens. So at the point of being given notice, you can make a decision to continue manually, or to take the provider pays option and have that data transferred for you. And that'll be up to each contractor to make their own decision on that. And the next slide. Right, okay, so here this is the farm outcomes video demo here, and we're not going to show it to you tonight because it is 15 minutes long, and we appreciate that you've all given up your evenings and a lot of time for that. So we'll make this link available to you afterwards, and that does give you the full patient flow through farm outcomes, a demo of that, and we recommend that you do watch it, but we won't show it to you now. We'll just share it with you all after the meeting tonight. And next slide, Alison. Thank you. On to the Q&A. So I'm not sure if we've got any questions in chat. If there's anything in the chat at the moment, nothing that I can see. So any questions?
Sharing, we can see everybody.
That's it. Yeah. Any questions from anybody? Please raise your hands and feel free to ask. Anything at all? Or we're giving you everything that you could possibly need to know, so there's nothing else. Can't see anything at all. Nothing dropping into the chat. Is there anything anybody else presenters would like to answer? Anything that we've missed before we finish? No, there's nothing. Brilliant. So what we'll do now, the next steps are we will share this information with you, share the presentation and the recording as well, so you'll have all of that and the link to the video. One last parting request from me is, if you've not already signed up for the service and you're thinking of doing it, please ensure that you complete all your training and you order your equipment before you sign up. Once you're signed up, you will be added to farm outcomes, and the trust can then make referrals. And what we don't want to happen is for patients to to be referred to your pharmacy if you're not quite ready to deliver the service. I've got a question, I think, actually, from Lee. And that question is probably one for you there at MFT Northern Carolines. How many referrals would we expect to see in a week? What would the workload be looking like, do you think?
I guess it depends. It depends on, because our referrals will potentially be split. It might be that it depends on patient choice of where they choose, whether it's the pharmacy team or the local community team or the cure service. So, I mean, I would say on an average, we probably get about 25-ish referrals that we send out to other services per week.
Yeah.
So across the sites, so across MFT, we're looking at sort of 75 referrals, but it's whether all of them go to farm outcomes or whether there's a bit more of a divide. I'm not too sure until it's up and running.
Yeah,
for
I think it'll depend on where your pharmacy is too, won't it? You know, there'll be hot spots of smoking areas. I know certainly in Bolton we had one pharmacy who received 5, I think, in about 2 or 3 days, and other pharmacies who have yet to receive any. So I think that it will vary as well on your location. Alison's got a hand up.
Yeah, I think just thinking about the experience from Oldham in the pilot, they're probably looking at around about 3 to 5 referrals per week. But again, there's, I think at the moment, off the top of my head, there's maybe 15 pharmacies in Oldham. So each pharmacy is maybe going to receive less than 1 per week, unless they're in one of those hotspot areas, like you said, Lou, where maybe there aren't any other pharmacies who are registered in a particular geography. So the volume is really difficult to predict. I think what we saw in the pilot in Oldham was that it was about 50-50 in terms of patients being referred to the community stop smoking service or to the community pharmacy service. And where patients wanted to be referred to community pharmacy was usually where their existing pharmacy was signed up to deliver the service, so they had a relationship with that pharmacy for other reasons other than stopping smoking, or it was a convenience thing that the pharmacy was open evenings or weekends, you know, accessibility in terms of them being able to pick up their NRT and that kind of thing. Lauren?
I think there'd be peaks and flows as well. So you've got times like Stoptober, and you've got the beginning of the year as well, where we tend to get more people that do want to quit smoking. So there tend to be sort of some weeks you could get quite a few, whereas sort of Stoptober, New Year, there are going to be a lot more people that want that service.
Yeah. Thanks everybody for answering that one. Have we got any more questions at all? Anybody else? Anything they'd like to be answered? That was a really good one, actually. Understanding the workload, and apologies we've not been able to fully answer, I suppose, what you might get in your pharmacy, but hopefully it gives you a bit of an understanding of the kind of volume out there. Anybody got anything else for us? No, nothing else. We did ask a question right at the start about the MAS service. I have had one response to me as a private message. If anybody else would be able to respond to that question that I popped in the chat, either via private message or just directly on the chat, we'd really appreciate that feedback before you leave. But if there's no further questions, I think we can let everybody enjoy the rest of their evening. And thank you very much to the presenters as well. Really, really good of you to give up your time this evening to support our webinar. Thank you.